Hello, I'm Dr. McAuliffe. Thank you for choosing Gentle Procedures. I just want to take a couple minutes and talk with you about the vasectomy procedure. So first of all, I just have a diagram to show you. So sperm is made down in the testicle and it travels up the vas and out. And so vasectomy involves cutting the vas in half and then closing off the upper end so that sperm can't travel through. And then also I bury the upper end in a natural tissue called fascia. That way, if these two sides ever got close to each other, there is a barrier or a shield between the two, and they're less likely to regrow. Also, intentionally, I keep the lower end open. This is called an open-ended vasectomy. The purpose of this is that way sperm is able to naturally leak out and the body reabsorbs it, and that way less sperm builds up in the testicle. So in addition to that, I don't use a scalpel. So it's called no scalpel vasectomy. And what that means is traditionally an incision is made on the left and right sides and then stitches are placed at the end. And the incision was about an inch. Instead of that, I just make a single tiny puncture in the middle and I use that tiny opening to do both sides. That way, when we're all done with the procedure, I just put a Band-Aid on and it closes over naturally in 1 week. So don't use a scalpel. I also don't use any needles. To anesthetize, instead of a needle, I just use an aerosol spray. So let's now talk about what to expect after the procedure. So after the vasectomy, really, the day of the procedure and the following day, you just want to take it as easy as possible. Sit in the recliner, keep the feet up, use an ice pack, read a book, watch movies, and then for 1 week, you want to avoid lifting more than 10 pounds, stay out of the gym in terms of weightlifting and running, and for 1 week, you want to avoid sex, and you can shower the day of the procedure or the following morning, but you don't want to get into a swimming pool or a hot tub or submerge until that tiny opening closes in about 1 week. Additionally, it's important that I want to tell you that for 3 months, you want to use a second form of birth control until we do the 3-month post-vasectomy testing. Thank you very much for choosing Gentle Procedures.